Thanks for joining us for the daily update. First things first, there are 7,405 cases of coronavirus in Victoria. That is 300 new cases since we last updated you. 51 of those are connected to known and contained outbreaks. 249 of those are under investigation by our public health team. There are 206 Victorians in hospital. 41 of those are receiving intensive care. I am saddened to have to report that there have been a further 6 deaths as a result of this virus since we last updated you. That takes the total number of Victorians who have died because of coronavirus to 55. We'll try and provide further information as we can, but each of those are connected to an aged care setting. 3 of those individuals, I'm not quite certain on gender in terms of the notes I have, but if we can update you, we will. 3 in their 90s and 3 in their 80s. If we can update you with any further information, of course we will. In the meantime, though, we send our best wishes, our condolences, our thoughts and our prayers to the families of those 6 individuals. This will be a particularly challenging and difficult time, a very sad time for them. And I hope that there is some small measure of comfort knowing that our support and our condolences are extended to them. 24,118 tests yesterday, still a very impressive number. That's sticking around that mid-20,000s number and sometimes higher each and every day. We're very, very grateful to everybody who's coming forward to get tested. Apart from a tiny number of people, each of those have symptoms. They're doing the right thing, acting on those symptoms, coming forward, getting tested, and then of course they need to then isolate while they wait for their result. We're pushing as hard as we can. We're using additional laboratory capacity from around the country, from the private sector as well, to get those results as quickly as we can. But getting tested is a very powerful thing to do. It's a very big contribution to our fight against this wicked enemy. But then staying at home while you wait for your results, that's really important as well. And we're grateful to people who are doing just that. There are 3,734 active cases across the state. I don't have a metro regional breakdown, but we'll provide that and other details on outbreaks and other matters when we get to the Chief Health Officer's release at the usual time, around 1:30, 2 o'clock as per usual. And now, I'll leave it to the Prime Minister to update on National Cabinet. I've just come from a National Cabinet meeting, but what I wanted to discuss today is part of our unique partnership with the Australian Defence Force, a long-standing partnership, one that has seen until last couple of weeks about 350 members of the ADF on the ground. That's been bolstered. It's now in excess of 1,400, and we're very grateful to all of those staff. In my discussions with Commodore Hill and others, they are absolutely doing fantastic work for us. They're well and truly integrated to both enable, assist and advise. And it's a really important contribution. There are many others as well, whether it be from other Victorian government agencies or Commonwealth public servants that are playing an equally important part. But I wanted to focus on one particular issue today, where we are deploying ADF personnel in an innovative and a unique way. So today's case is 300 cases. Each of those people, attempts will be made to contact those within the next 24 hours. Many of them will be contacted much, much sooner than that, but the aim is to have every single one of them contacted within 24 hours. That's not always possible, principally because some people won't answer the phone, some people, a much smaller number, may answer the phone but are not particularly interested in making a time to sit down and go through that that longer process to be interviewed about all their close contacts. That's about the number of people that we can't contact. And again, we're not making judgments about those people. In the main, it'll just be playing phone tag, if you like, back and forth, but not actually connecting with those people. That can be up to about 25%. It is unacceptable that we have anybody not contacted within that 24-hour period. And when I say contacted, not just a phone call outbound, but an actual interview conducted. What we're going to do, and this has happened the last 3 or 4 days to be proven up, when it's now going to be dramatically expanded. There will be some 28 teams of ADF personnel and authorised officers from the Department of Health. They will go out in the following circumstances. So one of those 300 people who's tested positive today, they are telephoned. They are telephoned again within a 2-hour period. If contact cannot be made with them via those 2 telephone calls in a 2-hour period, then ADF and authorised officers will be deployed to go and door knock those people and to conduct that interview on their doorstep, as opposed to doing it over the phone. It's not about making judgments about people being willing or otherwise. It's just a practical challenge. In any list of people that you ring, there will always be some that you can't get through to. This is about going that extra step to make sure that we can not just call, but we can connect and have that meaningful interaction, get that interview done, and then begin the process of tracing contacts. It goes without saying though, if you were door knocked and you were not found at home, then you are in breach of the orders because you are a positive case and you should be at home. So that would almost certainly lead to you being fined. So that's not the purpose of this, but if ADF and authorised officers, so Victorian Public Health staff, visit you and you're not at home, they'll continue to keep visiting you, but you'll have some very clear explaining to do as to why you are not at home, isolated, as you should be, because you have tested positive. This is a really important feature of our partnership. It does mean that members of the Victorian community, particularly across Metro Melbourne and Mitchell Shire, will see more and more members of the ADF moving around doing this important work. It is a very important task. It's not about commenting on what might be driving some of those people to be harder to get than others, but ultimately this will mean that each 24-hour period we will have gone taken those extra steps, made that extra effort in order to make sure that we are contacting each and every one of those positive cases. On today's numbers, I think it's best that we simply note that number is a lower number than it was yesterday, but again, no one should be, I think, moving towards trying to provide definitive commentary that we've turned corners or we're at a peak or any of that. Ultimately, it's in our hands, all of us. If we follow the rules, if we do the right thing, if we make the powerful contributions, large and small, there's often very simple things can make a big difference to the spread of this virus. I'm encouraged to see so many people across Melbourne wearing masks. I want to thank you for that. I know it's not always easy, but it is a really important way. The medical advice tells us we're at a different phase than we were the first time. These circumstances are different, and masks can play and are playing a really big part in slowing this down. I want to thank all those who are coming forward and getting tested. I want to thank all of those who are following the rules and only going out of their home for those 4 permitted reasons when they need to and only for the things they need. People are making many sacrifices. I'm grateful to all of you, deeply grateful. To those who aren't doing the right thing, well, Victoria Police are out there. They're working very hard. They are fining people. They don't take any joy out of that, but these are very high stakes, and it's very important that we have people following these rules. Can I just go back to a point I made yesterday before I asked Lisa to speak about some of the enforcement issues, and Deputy Commissioner Nugent's here as well, who can speak to some of the more police, some of the ops that Victoria Police have been involved in. Yesterday I made the point, and I'll make it again, whether it's to avoid a fine, whether it's to protect yourself or a loved one, or whether it's to get to the other side of this quicker, and many other motivations, but if they're just the 3 that are front of mind, choose any one of those. Do the right thing, follow the rules. That will mean you don't get fined. It'll mean we get out of this faster, and it'll mean that less people die. That is a pretty simple way of putting this. Everyone's got a stake in this. Everyone will benefit from us getting to the other side of this quicker, and on that basis, we're deeply grateful to those who are doing the right thing, and we are particularly focused on those who aren't. And I'd ask them to do better, to change some of the decisions they're making. But again, let's not detract from the fact that the vast majority of Victorians are making really significant sacrifice and a big contribution to us seeing much better numbers. How that pans out over the space of the next 4 weeks, well, we'll have to see that data unfold, the real data. But what we do know for a fact is that if we'd not gone to these stage 3 stay-at-home restrictions, we would not be reporting 300 cases per day. We would be reporting thousands of cases per day. We have, it would seem, avoided that, and that's a wholly good thing, because for every 1,000 people that are positive each day, there will be many hundreds that finish up in hospital, and there will be many who die. We don't want that. We want to avoid that, and it would seem that that's exactly what we've been able to achieve. Some even relative, and I emphasise the word relative, stability to these numbers is better than the alternative, that doubling and doubling again in the space of just a couple of days. But that's not good enough. That won't be good enough for us to reopen. We have to drive these numbers down, and that's why compliance, doing the right thing, get tested quickly, go home, and wait until the test result comes back to you. If you are positive, then obviously you've got to be at home for those 14 days, and you've got to be part of our process of contact tracing. And if for whatever reason you don't answer the phone, then ADF personnel will be knocking on your door, and they will bring the public health response to you, and they'll do that interview on your doorstep. That's not something to be afraid of. That's just everyone working together as one team to make sure that we've got the best public health response to this global pandemic. I now might ask Lisa just to talk about enforcement, but before I do, let's not in any way diminish the work that people are doing right across the state, whether it be members of our public health team, Victoria Police, ADF, Commonwealth Public Servants, AMBOs, a long list of people who are doing enormous amounts of work. They're working very efficiently, they're working hard, and they can't do it on their own though. They need each of us across the community to play our part, large and small. That is how we will get to the other side of this quicker. That is how you will avoid a fine. That is how you will protect the vulnerable, indeed every member of every family, because this is not just a disease of the frail aged. This virus can cause tragedy in otherwise healthy people of all ages. That's what the international evidence shows us, and that should be, between all of those things, that should be motivation enough for all of us just to stick together, look out for each other and do the right thing. I'll now ask Lisa to talk about some enforcement activity.
Thank you, Premier, and good morning, everyone. So we know that most people are doing the right thing. Victoria Police members will tell us that most Victorians are following the rules, and I want to thank them because they're making a difference. But we do still have people out there who have decided, whether because they don't care or because they think others can do the heavy lifting for them, that they continue to flout the rules. That's unacceptable, and that's what Victoria Police is out there in large numbers doing. We need everyone. As the Premier said, we need everyone. People must follow the rules. This is what is going to make a difference. If you're not following the rules, you've got to ask yourself, why? What am I contributing to this? Why am I doing this? Why am I trying to get through an unrestricted area into an unrestricted area? What good does that do any other Victorian? We know over the last 24 hours, police have done over 5,300 spot checks, and I think the figure is now up to 154,000 checks since this first began. That's through patrols, it's through home visits, it's checking on businesses, it's following up on the police assistance line calls. Really significant number of checks that they're doing, and unfortunately yesterday they had to issue about just over 100 fines, 101 fines, 63 warnings. One of the bigger numbers. And you have a look at those figures. It's people who decide they're still wanting to party, people who have decided that they want to continue to go to brothels, people who have decided that the gym can continue to operate, and of course people who have decided to go into unrestricted areas. Our police assistance line, and I want to thank all those people who continue to use that as a way of letting police know where there may be concerns in our community. That received 1,300 calls yesterday. So again, large numbers of Victorians who are trying to do the right thing, people who are already doing the right thing, wanting to make sure that other Victorians are also doing the right thing. In terms of masks, I think the message, and the Deputy Commissioner would back this in, is that overwhelmingly people in Melbourne and Mitchell Shire have absolutely done the right thing about masks. They've embraced masks, they're doing the right thing. But unfortunately, despite the fact Victoria Police have got a discretion policy, they're handing out masks, they're talking to people about why they need it. They've had to have a handful of fines yesterday, people who refuse to wear them. So be in no doubt, whether you're trying to get through a roadblock, whether you're trying to get away with not wearing a mask, whether you're trying to have a party, Victoria Police will be there and fining you if you do the wrong thing. Again, most people are doing the right thing. Most people are doing the heavy lifting out there. We just need everyone to do a bit of that heavy lifting. So Victoria Police will continue to focus on those blatant, obvious and deliberate breaches. Their discretion period for masks will continue over the next 7 days, but be in no doubt that for all the other incidences, the discretion period is limiting, and that's why we're starting to see the sort of fines we saw at the start of this pandemic. Victoria Police members don't want to be doing this. For anyone out there who decides that they can try and test the rules, or they want to test Victoria Police, or they want to try and encourage other people to breach the rules, that does nothing for Victorians, but be in no doubt Victoria Police will continue to enforce these rules as we go forward. And I want to thank each and every member of Victoria Police who are out there doing this. And I also want to thank now the members of the Australian Defence Force. So at the moment we have around 250 ADF people who are doing either the roadblocks with Victoria Police, or who have now started on a new series of patrols around high profile areas, high pedestrian and cycling areas like the Tan, like Princes Park, like Albert Park Lake. And they'll continue to work and walk with Victoria Police to help us enforce these laws. Again, they're there to provide reassurance, but if people are obviously breaching these rules, they'll also be there to fine people. So can I thank the ADF, and they'll continue to grow in numbers in supporting Victoria Police doing this very important role. So again, just do the right thing. Ask yourself, do you really need to do it? And if you do the right thing, you won't need to get a fine, and you'll help all us get on top of the spread of this virus. Any questions?
Take any questions you have.
Premier, the AMA is calling for stage 4 restrictions. Why won't you enforce them?
Well, the Chief Health Officer and his team provide us with advice based on the cases that present and the circumstances that we face. Others can have different views, that's entirely a matter for them, but the Chief Health Officer and his team are the people who provide advice to me and to colleagues. AHPPC at a national level provides advice to National Cabinet. There'll be different views at different times, but we have got settings in place. They've been in place for just two weeks. We always said this would get worse before it got better, that stability was always had to proceed driving down those numbers. I've got no advice to move to a so-called stage 4 or to change those rules. At the moment, we believe that with masks, which is a change beyond what we did last time, stage 3 stay-at-home orders, and enhanced enforcement activity and some other small changes, but they may well be significant in terms of efficiency and the kind of effectiveness of our public health response, right down to very small numbers of people. We're confident that these settings are right. Having said that, though, I've made the point hundreds of times now, it is wildly infectious, circumstances change quickly, and if I get different advice, then we won't hesitate to act.
There's been some concern about the changes made to visiting the maternity wards. Can you just clarify what those rules are?
What I might do is ask the Chief Health Officer to speak to that. If there's a need for any clarification, I'll let him do that, as it's a matter of clinical governance. But why don't we, do you want to keep going, and then we'll get Brett up to do that and any other matters you want to do? Or I'm entirely in your hands. Fine, no worries, Brett, come on.
Thanks, Premier. In relation to visits to pregnant women and during the labour and birthing process, I think there has been some confusion. The directions state that a support person or partner can stay as long as is desired and needed for the labour and birth process, as long as is required. So that is not limited at all. For subsequent days post-delivery, there is a visit limit of 1 person and for 2 hours. That is a change. It was previously 2 people for up to 2 hours. And for antenatal visits, there's been no change. So that support person or partner can accompany a pregnant woman for antenatal visits. There are the same restrictions as applied previously, not to attend tests such as ultrasounds, etc. But otherwise, the only significant change is a reduction of 2 visitors for a 2-hour period to 1 visitor for a 2-hour period after delivery, and after that visit that accompanies labour and delivery.
So when you say support person can stay as long as is necessary, would that be like the 3 days following, say, if a mother feels like she needs the support of the partner for, I guess,
Yeah,
those days afterwards?
if a support person or partner stays continuously, there is no limit in the time that person can stay.
And can you understand the distress some of this confusion has caused over the last couple of days? How come there was so much confusion?
Look, I'm not sure I understand legalese. It's very hard to sometimes easily interpret in lay terms what a legal direction is. But for the purpose of clarification, I'm very happy to stand up here and to provide that. The legal directions were written in a certain way. They haven't been understood in a lay term to support the fact that someone can stay for as long as is required during labour and delivery, but that is the case, and I'm very happy to make it clear now.
Brett, you can understand the distress that's...
Oh, absolutely, I understand the distress. Someone who feels that they can't be there for the most critical time in their partner's life and indeed in their life must be a distressing element, but you know, we have comms working actually 24/7 to support all of the new directions that are made, and they run to dozens and dozens of pages, and the frequently asked questions and all of the supporting materials for each and every direction, which are really under continuous change, are working flat out. But as soon as we hear that there is a misunderstanding or concern about something because it's been interpreted wrongly or because there's lack of clarity around that wording, we're very happy to work to make it clear.
Just to be clear, if the birth partner can't stay the night, as is often the case in the maternity ward, the next day, do they become classed as a visitor and they're only allowed 2-hour visits, or can they come back?
So it's always been the case that after the delivery, when a support person comes back, that there's a 2-hour limit. The difference now is that it's a single person who can come for that 2-hour visit, and one presumes that that's the birth partner, but it doesn't have to be.
But if they can't stay the night, as is often the case, then they'll only be allowed for a 2-hour visit. But if they can stay the night, then they can stay as long as they could stay for 3 days. Is that?
That's right. That's right.
So there's a big discrepancy then, I guess, on what hospital you're in. You know, whether you've got the luxury of being able to stay the night or not.
Well, that's right, but the reality is if someone needs to stay and wants to stay right through the delivery process following labour, then they are free to do so, and there are no limits in that regard.
Given the number of cases that we now have active, and given what you said about 1% being expected to die, can we expect roughly 5 to 6 deaths for the next week or so?
Yeah, I have always expressed concern about the fact that whenever you have hundreds of new cases a day, that there will be several people who are expected to die in the following 2-week period. I'm afraid we will see that. I expect that to occur. That's very tragic, and it is focused in those who are most vulnerable, and we have seen the very elderly who've died, especially in the last week. But with large numbers of cases, there are a number of other people, younger individuals who are hospitalised, and they are at risk of serious illness as well. And some of those people who are in intensive care and on ventilators are younger individuals. So that's an absolute tragedy. And of course, we're working in whatever way we can to drive those numbers down. We do know what the solutions are. It is isolation when you're symptomatic, getting tested, and having your close contacts quarantined. Those things work. Masks are our stage 4 in a way. I understand the temptation to go to a stage 4 that might be a shutdown of everything, but the epidemiologists who are working with me focus on where transmission's occurring, to whom it's occurring, how it's occurring and why it's occurring, and we're focusing our interventions in that area. We know that there are challenges because of essential work, because of healthcare settings, aged care settings, and a casualised workforce, and we're working very hard in those areas. A broad sweep of a shutdown of industry carries with it its own harms. It's not to say that it's not on the table if that's what's required, but the epidemiology is telling us that that is not the case. And the reality is that unemployment is a public health issue, and forgoing your mortgage is a public health issue. Bankruptcy is a public health issue. And if we can get on top of this with the interventions that we have and really fine-tuning them, understanding where transmission is occurring, that's how we should approach it, with an evidence base and with a very focused and targeted intervention. Masks may well be a game changer. The proof is in the pudding, and I want to see how numbers go over the next couple of weeks. But Professor Raina McIntyre, Professor Nick Talley, very eminent Australians with respect to communicable diseases and epidemiology, think that masks can make a really significant difference. And you couldn't be prouder of Melbourne to see the way that people have taken up mask wearing, with it not having been a habit really historically, to see so many people who are willing to do it and do it with pride. I think it's a symbol of the care that we have for the people around us, and so I hope that people can wear it with pride.
Can you understand why the AMA has made its call, your medical colleagues? Can you understand why they've done it?
Yeah, look, I think the AMA are looking at the numbers, seeing that the turnaround in numbers has been slow, and want to see everything possible done to drive those numbers down. What I would say is we are on that pathway. We are trying to do everything possible, but we are doing it on the basis of the data, the epidemiology, and our understanding of where transmission is occurring and how it's occurring, and that's what we're focused on.
Are you essentially saying that a more severe lockdown might not make a difference because it would make a difference in the groups that are spreading the virus?
Yeah, in a way, that's exactly what I'm saying. I think you can go to a very, very broad shutdown. It will have its own harms, and it may not turn around the transmission because of where we're seeing the transmission occurring. We know that healthcare, aged care, abattoirs, big distribution centres are the areas where transmission's occurring. The things that we've made in directions relate to healthcare and aged care for that reason. WorkSafe are working very strongly on tightening the kind of oversight and the kind of OC health and safety obligations in those other high-risk settings to make sure that they're reducing the risk of transmission there as well. So they're the areas we need to focus on. If other things emerge, if there are other areas we need to go to, we'll absolutely go to them.
Brett, do you think with the death toll going up, do you think that should be a wake-up call for Victorians that it's more than about masks or restrictions, this is ultimately about people perhaps dying?
Yeah, I think it's getting through. I think the fact that people are wearing masks, with its own discomfort and imposition, I think the fact that it's been taken up very enthusiastically is a recognition very broadly that people understand how serious this is, and the fact that it is slow to turn around, and that if there is something that we can do to get out of this faster, then we're all doing it. And I think we may well see improvements by virtue of the mask wearing that is going on now.
Are you increasingly concerned about the situation in aged care, particularly given our new deaths today? And what is the current breakdown between staff and residents who are infectious? Because there are calls that we may need to bring in staff from elsewhere to help replace the ones we're losing to isolation.
Yeah, certainly there are a number of staff who are infected and a number of others who are close contacts who need to quarantine. The Commonwealth has been very supportive, and we're working very closely with them on that replacement workforce as is required. For residents, there are probably more affected residents now than staff because of that potential for transmission between residents. But again, all of the things we've got in place in aged care relate to trying to minimise that transmission, the mask wearing for staff, the absolute exclusion of any staff who are unwell. I would also raise the idea that if staff are coming from a family where someone is unwell, they should really think about making sure that any family member is tested before they're turning up to work, because that could be the very first sign of coronavirus within their home. In terms of where residents are cared for, from a public health point of view, sometimes we know that transmission is harder to control in certain aged care facilities, but it is a decision between health services, the clinicians and the aged care setting about where those residents are best looked after. Sometimes that will be transferring them to a hospital setting. Sometimes they will receive ideal care right where they are, and that will be a greater danger for them to move. So we don't have a blanket policy about removing people from aged care if they're infected, but again, from a public health point of view, if there is a risk of transmission that is better controlled by moving residents to acute care, then we'll do that.
Are you worried about a looming staff shortage in aged care, given the numbers that have now succumbed to it?
I'm not aware of it. I know the Commonwealth has significant surge capacity that they've already deployed and would continue to do so as is required. But it's a pressure point, there's no doubt about it. But yeah, I'm not aware of a significant shortage that's going to put aged care provision in jeopardy.
And are you also aware of the role Northern Health has come into St Basil? Can you tell us what role they're taking and why they've done that?
Essentially, Northern Health are supporting the clinical care of those residents. They're probably getting as much clinical care and oversight as ever. So I think that's part of providing as much support as possible to that facility with a really significant staff turnover.
Brett, I know you've mentioned it before. What's the time period we're seeing between when someone becomes infected and when deaths happen?
Certainly the deterioration after someone becomes infected, for those most vulnerable, happens at the 1 to 2 week mark. Some individuals develop symptoms and get some respite, get some amelioration of their symptoms before deteriorating again. But the 2 week mark after developing symptoms is a really critical time. It's also very important to make sure that if there's any deterioration through that course of illness, that people flag it with their primary carer, with their specialist, to make sure that they get an early intervention as soon as possible, because having that oxygen, having that steroid treatment or other antiviral treatment can make a real difference, and will make a better difference earlier on.
Minister, there's footage going around of someone who appears to sort of talk their way through a police checkpoint. Is there a concern that people aren't necessarily following the rules that might go up, and what powers do police have if people are reluctant at those checkpoints?
Well, let's be really clear, that footage shows an incredibly selfish person who deliberately attempted to cause issues for police, get around it, and obviously by putting it on Facebook is also encouraging other people to do that. I know, in talking to the Deputy Commissioner, and whether Rick wants to add to this, is that Victoria Police will again say to their members that they are required to look and see a licence to make sure that people are going in the right areas and ask the questions they've been asked to. This person obviously sought to try and embarrass this police officer, and I feel actually bad for the police officer who was there, but she may not have realised that the police officer was wearing a body-worn camera, and that body-worn camera is able to be used and has been used to be able to identify the person. So I'm sure she'll be looking forward to a knock on the door from Victoria Police members. So, people can do this. They can try and flout the law, try and show they're smarter than anyone else, but it does no one any good.
So will she be fined?
Well, Victoria Police will they know who she is. They will go and seek her out, and obviously that's then a matter for Victoria Police how they best deal with it.
Can we ask Rick, just for your just how are members dealing with these sort of situations? Is it a common thing?
Firstly, I'd like to say that our members are out there all day and all night, working incredibly hard to keep the community safe. They're working incredibly hard to prevent people going into areas and putting other people at risk. And so I'm really proud of what they're doing and thankful for what they're doing. This was a selfish and childish act. It was ridiculous and it was unnecessary. If that woman lived in that area or had a good reason to be in that area, she would be allowed through. If not, she's breaking the law. So from our perspective, we will pursue this. We will speak with the woman concerned and issue an appropriate fine had she not been permitted to be in that area.
Is this something that has happened before? Have you heard anecdotally from your officers this has happened before?
We're starting to see from time to time in more recent times people talking about their human rights. These are clear criminal offences. They're offences under the Public Health and Wellbeing Act. It's not one of your human rights to endanger other people. It's not one of your human rights to put other people at risk. So we are seeing it from time to time, and we continue to work with our own members and the powers and the laws that are available for them. I do feel, as the Minister said, for this particular young guy, or this policeman, he was put in a difficult position, but we'll reinforce those powers that are available.
Are you satisfied you have enough powers to stop people, to tell them or to ask them where they're going and to produce their IDs? Have you got enough power?
Yes, we do. So where there is any evidence of a breach, then certainly we have the powers to demand a person's name and address and issue that fine if that's the case. Clearly, every now and then we might just be inquiring as to their reason for being somewhere, and if there is no evidence that they're breaching, then they go on their way, so that's fine. We have the power at a checkpoint, for example, to demand a licence of a driver, and based on that licence and where they live, we can then pursue it further.
And, obviously it's great, we've all got hindsight and we weren't in that situation, but that officer, in hindsight, should that officer have been stronger?
Yes, in hindsight, he could have been. So in the first instance, he could have asked the person to produce a licence. They are required to produce the licence, and then from that licence we inquire further. What the members have been trying to do is work closely in supporting the community and their reasons for travel, because we're finding the majority of people are legitimately able to travel for work and other purposes, and where they're trying to limit the time that people spend on the checkpoint. So they haven't actually been asking for the licence commonly in the first instance. Unfortunately, if we get this type of behaviour, we'll need to do that on each and every occasion, and then from that we can take it further.
How, on the issue of masks, I think the Minister mentioned there's been a few people issued with fines. How's enforcement of that gone, and have you been at supermarkets and places like that?
Yep.
Just walking around the city?
So firstly, and it's been touched on by the Premier and the Minister, the community has been outstanding in embracing the wearing of masks, and we are extremely grateful for that. But we are still seeing some individuals who choose not to. Those most commonly we've had in the last 24 hours are people who are offered masks by police who still refuse to put a mask on, and so it's their right not to wear a mask. In that instance, they've been issued with fines. We are also patrolling supermarkets, shopping centres, other populous areas to ensure that people are complying. But I have to say, it has been an outstanding take-up by the community, and the community working together and embracing this to do all we can to slow the spread and not put others at risk.
Can I ask Brett Sutton another question? Sorry. With the ADF coming in and concern raised earlier in the week that people are not staying home when they're infectious, why not continue that at-home testing program that was rolled out, I think, 4 weeks ago during the suburban testing blitz? I understand it comes to an end this week. Why not continue that program?
I'm not sure I know the reference to an at-home testing program.
Yeah, so during the suburban testing blitz, when people were given, if they couldn't make it to one of the suburban testing blitz sites, they were given the swabs to do themselves. You know, it wasn't a huge take-up, but I'm just interested why that program wouldn't be continued.
Yeah, look, it was piloted that people could do some self-swabbing. That's still an option where a drive-through or drop-in testing site means that someone isn't prepared to have their kid tested, for example. So that's still on offer. If a normal clinical swab can't be taken. But there were, more logistic challenges than it being much of an enabler for people, because you needed to drop it off, you needed to pick it up in a very timely way, and there was more effort involved than the reward. I think the fact that there are so many, over 160 testing sites, almost all within 10 kilometres for any individual, certainly across Metro Melbourne, I think that's the main thing that's going to help people to get tested as they need to.
Brett, I've just got a question about the app. With so many cases, and we see probably hundreds every day that aren't linked to outbreaks straight away, again, why are we not using the app? And again, have we found any contacts that haven't been found through the manual methods, and how many times has the data been?
I'm not sure of the actual contacts that might have been found with the app. There are over 400 people who've had the app downloaded amongst the cases that we've had in recent weeks. So that's a sign of a pretty good download. And again, I would encourage anyone to download it on the basis that they might be next to someone whose details they don't have for more than 15 minutes. That includes in some of the workplaces where it's difficult to physically distance. Obviously, a lot of workplaces we say, right, everyone's a close contact, but there are other workplaces where we ask the individual to identify those people who are their close contacts. It would be useful for everyone in a workplace to have the app downloaded, because you might flag someone who you haven't thought of as a close contact previously.
So whether it's in the workplace or whether it's at shops or the supermarket, what is the reason that we're not using more? Is it a lack of people actually having the app in the first place?
Well, we know that there are over 7 million people who've downloaded the app. That's a significant proportion of those who have smartphones. But if you take that as a third of all adults, if you like, then the number of people who both have it in an interaction is still at the kind of 10-15% mark. So we could do better. So having a 50-60% download for anyone who has a smartphone would be a much better coverage and really increases significantly the number of Bluetooth connections that are made that allow us to find that close contact.
The Mantra Hotel in Preston, how many cases are there among both staff and residents, and are the use of these isolation cells considered compliant?
I don't know for the Mantra Hotel, sorry, I don't have details on that.
It's a refugee hotel.
Yeah, it's a Commonwealth-run facility under Commonwealth refugee obligations.
Are you anticipating any particular issues this weekend, first, where masks are required?
Lundy, I'd anticipate that it'll be not an ordinary weekend, because people obviously will be at home. There'll only be 4 reasons to leave your home, and if you're out for any of those 4 permitted reasons, then you must be wearing a mask. There are some very narrow exemptions, underlying health conditions and things of that nature, but you know, it's quite amazing to see people across Melbourne embrace and put that mask on. It is a relatively small contribution to make. Is it the most pleasant experience? No, but it's making a big difference in slowing the spread of this virus. So if the last couple of days are any guide, and I think they are, we will see people out and about following the rules across Melbourne, out when they need to be for the things they need, and when they're doing that, they'll be wearing a mask. And I think that's something that everybody should be very proud of, and everyone should, and certainly everyone should know that I am deeply grateful that that will make a big difference.
Did Commodore Hill have any sort of thoughts or ideas about how we can improve our response, and is the government investigating anything along those lines?
There's a whole team of people who are working in contact tracing, in community engagement, in law enforcement, particularly the announcement I've made today, where there'll be large teams of ADF and authorised officer personnel out knocking on doors for those harder to track down people who just aren't answering their phone, or for whatever reason we can't seem to get through to them. That's just one example among many where ADF, as well as other public servants, others from other government agencies who wouldn't necessarily be part of a public health response, but this is all about making the best use of the best skills, and we're deeply grateful to have those people here.
Can I ask on the border situation?
Yes.
A group of senior doctors has written to New South Wales Health warning that lives are at risk due to that situation on the border. What's being done to remedy that situation?
There's been discussions between our government and the New South Wales government, between our Health Minister and New South Wales Health Minister. I'm happy to take this a bit further and have a conversation with Gladys over the course of the weekend. I'll try and do it as quickly as I can. The issue is well known, and if we continue to see people like health workers unable to move freely, not throughout New South Wales, they're simply wanting to move from a border community on the northern side of the river. They want to move south, not that far. They're doing the best and most important work. I'm confident we can find a way through on this. There's certainly no lack of effort to try and get that outcome. I didn't have an opportunity to raise it in National Cabinet, wouldn't have been the appropriate forum anyway, but I will have a one-on-one conversation with the Premier of New South Wales about this issue.
They want a dedicated emergency lane on that crossing for emergency service workers and medical staff. Is that
Yeah, to be honest, I'm probably, that's not an unimportant issue, but I'm more concerned about staff who live in New South Wales in the case of Albury, we run the Albury Hospital, even though it's in New South Wales, not being able to freely move. We'd like them to be able to move freely and quickly, but it's the freedom of movement, I think, at least as I'm briefed, that is the most significant issue. The notion of nurses coming to Wodonga, Wangaratta, wherever it might be, and having to quarantine for 2 weeks because they simply worked a shift saving lives, that doesn't make any sense. They're not travelling to Sydney. They want to go back to their border community where they live, and that notion of a bubble where you essentially move the Victorian border north for however far that is. I think it's now down to a couple of k's, but it's also about permits. Who gets given a permit? Who is actually allowed to travel? And I don't think there's any point of argument, or at least there shouldn't be, that health workers who might live just in New South Wales but work in Victoria, we've got to find a way to continue to have them at work.
There was a young nurse at the Royal Melbourne Hospital who made an impression, please. You put that on your Facebook page. Why did you do that?
Because we've got to stop thinking about our nurses and ambos and doctors as the front line. They're not. They're the last line of defence, and if we don't all play our part, following the rules, getting tested when we're sick and doing it quickly, staying at home waiting for the results, if we don't all work hard to follow those rules and play our part, then more and more nurses and doctors and ambos will get sick, and they'll have more and more patients to treat, and sadly many of those patients will die. We are the front line in the decisions we make, the choices we make, the conduct that we exhibit, calling out bad behaviour. We are all on the front line, and that's why it's so important. And it does make you proud to think that Melburnians have so rapidly embraced the wearing of masks. It's a tiny number of people who aren't, and as the Deputy Commissioner's just made the point, police are out and about and they will be getting a fine, not because the police take any joy in that, but because no one has the right to make selfish choices that put other people at risk. Nobody has that right.
Just one final. Were you quite moved when you?
Yeah, look, she's like so many, an absolute hero. Our staff in hospitals, and it's not just clinical staff, it's cooks and cleaners and ward clerks and orderlies. It's not just health, it's right across emergency services. Far from criticising that member of Victoria Police, I'd say that he's one of thousands of people who are putting themselves in harm's way to keep the rest of us safe. And the least we can do, all of us, is do our level best to follow the rules. The problems are not where people might err. It's people who I think are blatantly doing the wrong thing. It's not a massive number of people, but it doesn't have to be. This is such a wildly infectious disease. It doesn't take much before it's off and away, and you've got really significant numbers of people who've got it, and then a really significant challenge. That's where we're at right now. The strategy will work if everybody buys into that strategy and is compliant with it. And just whether they are pleased about it or not, acknowledge that this is the reality we face, and unless we all follow these rules, then people will either get a fine, it'll take longer to get past this second wave than would otherwise be the case, and people will die. They're three pretty powerful motivating factors, I would have thought. Choose one of those three, or any one you like, but ultimately, let's protect those who are protecting us. Let's look out for those who put themselves in harm's way every day. Let's not contribute to them having to treat more patients, be exposed to more virus. Let's not contribute to more families having to bury a loved one.
On the door knocking, Premier, I think
Yes.
you mentioned about 25% of people aren't doing the
Roughly, yes.
24 hours. What dangers does that present if people aren't doing that interview, and how much of a concern has that been for yourself?
Well, it is a significant concern. That's why ADF and Health Department staff who are authorised to do that work are going to be out and about visiting all those people. So just to go back through the logic of this, anyone who makes 100 phone calls, there'll always be, let alone thousands, there'll always be a handful of people who you can't get through to. We'll be making 2 phone calls within 2 hours if you don't answer, or if you're not in a position to do the interview, then we will be coming to you. And ADF and authorised staff will visit you. They'll conduct the interview on your doorstep. That's not ideal, but it's certainly much better than not having an interview for an extended period, because it's from that interview, you retracing your steps, telling us where you've been, who you've been close to. That's how we know who might be positive, and then all that coronavirus detective work starts from there. If we haven't spoken to you for whatever reason, then obviously that work is much, much harder.
Just on the $1,500 payment that's available to
Yes.
people who can't get sick leave, I think yesterday's stats showed that more than 1,200 people had applied and only 182 had received it. And we're hearing lots of stories about people calling the number and being told mistakenly to go to Centrelink. Are you confident that people can get that payment?
Well, there will be some people, Rachel, who should go to Centrelink because they would be entitled to various payments. I have not seen those reports. I'd need to check that out for you. The facts of the matter is this. It's not just $1,500, it's $1,800 between when you first get tested. If you have insecure work, if you don't have sick leave to fall back on, then you can receive that $300 payment. We're doing our level best to make those payments as quickly as possible. Most people get paid once every week, some people get paid once every fortnight, some people might get paid even less frequently than that. I think what's most important is not so much the money going into your bank account within seconds of you making the phone call. I think having an answer and knowing that you are going to get the money, because you weren't necessarily going to be paid at the end of the shift you're not working because you're at home. So there is a bit of leeway there, but we want to try and make that the fastest process possible. And that's why there's extra people doing that in the team. We're talking to the government's banker. We're doing all sorts of things around electronic funds transfer. We're not leaving any of those options. We are looking at all of those options, I should say, to make sure that we can get those payments out as quickly as possible. But I think the key point is to tell people and have people with certainty, you are going to get this payment and we'll get it to you as soon as we possibly can. That's what I'm aiming for. And then people can plan knowing that that money's going to be there, just like the shifts they're not working would have seen them get paid on their usual payday, whenever that might be.
Premier, school teachers are raising concerns today about teaching in class, the level of transmission that's happening. At what stage would you guys review in-class learning? I suppose what's your message to those teachers that are worried?
Those matters are under review every single day, based on case numbers, based on outbreaks. We think, and the public health advice is very clear to us, this was confirmed at National Cabinet today. If you look at the settings from the other end, the fact that year 10 down are all at home, that's limiting movement. That's something that I think has very, very broad support, whether it be at AHPPC level or at National Cabinet level. We can't have 700,000 people moving around plus their parents. That would only contribute to spreading the virus. As far as settings around year 11, year 12, attendance rates are very high. They're very, very close to the numbers they were this time last year. That goes not just for Melbourne, but also for across all the cohorts in regional Vic. We're very pleased about that. I understand that teachers and other staff have got some concerns. This is a concerning thing. This is a really challenging time. We're there to support them. We're there to make sure that, for instance, if a teacher's got an underlying health issue and doesn't want to be at school and wasn't during the last remote and flexible learning, or at any point during the pandemic, we'd always seek to make arrangements for them. Beyond that, the wearing of masks, again, is challenging in those educational settings, but I can tell you that my eldest, who headed off to year 12 classes today, he was wearing a mask. He's wearing a mask in class. His teacher is for not necessarily the entire period, but except for the first few minutes when they might be setting tasks for that hour or hour and a half's work, they are in fact wearing a mask. So everyone's doing their level best, and the advice is that that's safe, or at least it's at such a low risk that it justifies the sort of reward we get, which is VCE and VCAL meaning the same thing for every student across the state.
On that, kindergarten and preschool teachers are similarly concerned, and they are required to be there. And
Yes.
I understand attendance is quite high there. There are parents that drop off and pick up.
Yes.
There are lots of hygiene measures in place, but
There
I
are.
understand staff are quite concerned.
There are. I think staff in every setting are obviously concerned and are doing everything they can, regardless of the industry. So whether it's a person stacking shelves at Coles, Woolworths or IGA, a person working in childcare, a person working in a hospital, a police officer, an AMBO, a public health worker who's going and door knocking positive people, everyone's doing their level best to try and keep themselves safe and to fight the virus, not to contribute to spreading it. So I'm grateful to all of them. that degree of concern, you can absolutely understand we're all concerned, because this is not something you want to get, and it's certainly not something that you want to spread.
Just on the ADF as well.
Yes.
1,400 today. Is that new ADF members coming down? Can you tell us what the total ADF?
It's around 1,400 in total. So it started was before my most recent series of discussions and agreement with the Prime Minister, which I can check for you, but I think that's a couple of weeks ago now, 2.5 weeks ago, where we agreed to boost it further. And again, we're very grateful for that. That took us from about 335, and then we added in just over 1,000, which now gets us to roughly 1,070, something like that, which gets us to that 1,400 number. And my latest report was that all of those who had been promised to us are in fact here, give or take a handful, but they're performing all manner of different functions. They're not the only supports we're getting. There's a whole. They're pretty noticeable. Obviously in uniform, moving around the community, but there are many people in call centres, public health experts in other states that are making phone calls for us, doing contact tracing, and then there's a whole range of other Commonwealth and state public servants who aren't necessarily in a uniform, but they're doing really important work too.
Can I just ask you about the app as well?
Yes.
When it was first starting, we were told it was kind of our sunscreen against the sun and everyone should download it, but it seems over the last few weeks it barely gets mentioned at these press conferences.
I don't think there's any sunscreen equivalent when it comes to this virus. I just don't. I would just make the point. I think you used the expression in your questions to Brett that we're not using it. That isn't the issue. It's not that we're not using it. It's that it's not relevant to a whole range of the cases. Crossroads Hotel, for instance, up in Sydney, I'm sure they would have used the app there, because it's by its very nature, it's a gathering of people you don't know. So if you're in a group of 300, now that's not an issue here because we don't have any groups of 300 other than in workplaces. Where there's a reasonable certainty about who's working. You've got rosters, you've got lists, you've got a sense of who's actually working for you. In those big settings where you don't know people, that's where the app would be at its most powerful. I'm not sure whether it was used up in Sydney, but that would be the setting where it would be most powerful. Again, the point Brett makes is a good one, and I've made it myself many, many times. Download the app. I've downloaded the app. My kids have downloaded the app. Kath's downloaded the app. If you download it, the more people who download it, the more effective it'll be, because it'll just mean that you've got that electronic handshake between more and more people, because everyone's got it and they've got that. That'll mean that it'll be of greater use to us. Arguably, probably of its greatest use when we get to the other side of this second wave, when we start opening up again and we see again larger groups of people moving through restaurants, cafes, all those sorts of things, public transport, people that you don't necessarily know. So I wouldn't say it's not being used. That isn't accurate, but it's not relevant to the cases we're seeing, because it's not like people are out in large groups and they don't know who they have been in contact with. Any other issues? You sure? Very good. Thank you. See you tomorrow.